make the pectoral girdle. Pectoral girdle is the set of bones that, the group of bones that connect your bones of the arm to the actual skeleton, right? So you have clavicle and scapula. Let's look at the clavicles first. If you look at the clavicle, it has a specific shape. This end is more curved compared to that end. It's like kind of cut very flat. This attaches to the sternum, so they call it the sternal end. This end actually attaches to the acromion process on the scapula, so we call it acromial end. Okay, and then you have a tubercle on the other side, on the curved end. There's a bump on the bottom that we call the tubercle. This is the scapula. This is the front or back, anterior or posterior view? Anterior view. So you can say, because the spine is missing, the spine of the scapula is always on the back. You can even touch and feel on your body. So this is going to help you to remember which is your acromion coracoid process. Okay, we'll come to that in a second. So first, when you look at the scapula, we are going to do some of the easy parts. So first we can look at the borders. These are the borders. On the top, the superior border. This will depend whether it's your right or left bone. To me, this looks like my right. Okay, because my glenoid fossa should be here for the humerus to attach. So this is my right, so this is my lateral. Other way, you can remember all these projections are on the lateral side. So this is my lateral border. Where's my medial border? Okay, so you have to have some idea about the bone to tell whether it's medial or lateral. For many things, your condyles, epicondyles, everything, there's a medial lateral. So you have to know which is right, which is left. Then there is a notch here. That's your scapular notch or suprascapular notch, because it's on the top of the scapula. And the cavity here is your glenoid cavity or glenoid fossa. And these are your processes, the acromion and coracoid process. What we are looking at is the coracoid process. The acromion process comes directly off of the spine. This fossa here is subscapular fossa. And let's look at the posterior view. So if you look at the posterior view, that's your spine, right? Scapular spine. So what is this part? Acromion process. That's your coracoid process. And there's the cavity here and here, above the spine, below the spine. Below the spine, how will you say that? Infraspinous fossa, inferior to the spine. And above, supraspinous fossa. Here you can see the glenoid fossa, the glenoid cavity very well. Okay, so now let's do the humerus and the other bones of the arm.